Hello, everyone. I am going to just give you a brief overview of the National Youth in Transition Database. There's a lot to the database, so I'm going to kind of limit my presentation to how it sort of fits in the framework of our homeless and youth and the US ICH framework. Just to give you a little sense of how it is and how it can be used as sort of a national overview of what's happening across the country in terms of some of these outcomes and how we can kind of use some of the United work to get a glimpse of what's going on within states and across states. Sorry for this little, there we go. In case you don't know, just a brief overview. Under the CHAFE Act, states are required to collect information on youth about the services they receive and also some of the outcomes that they experience as they age out of care. Basically, two populations of youth, kids who are age 17 are surveyed, and then surveyed again at 19 and 21, and then states also report all the youth who receive independent living services administered by the CHAFE funds each year. Starting in 2011, we started to collect data. This gives you a sense of some of the information that's collected, demographics, date of birth, race, ethnicity, those kinds of things. Some academic support for the services, career prep, budgeting, things that are very appropriate, and services that parallel a lot of the services and the typology that Maria referenced in her presentation earlier. And then the outcomes on the youth that are surveyed: financial self-sufficiency, education. We do ask a question on homelessness. That's a big indicator for us, and high-risk behaviors. Gives you an idea of the data collection schedule. As I said, we started in 2011 for the first cohort of youth, the 17-year-olds that were surveyed, and the services are collected every year. The 19-year-olds were surveyed this year. Their information should be in November 15th is our deadline for reporting. So we should be able to start analyzing that very soon, and we'll get a sense of the outcomes of them at 19, of those youth that took the survey. And the next slide will show you a little bit about just the wealth of data that we currently have. At least I think it's a good start for our first year. So as of March, we had over 175,000 records, youth reported to our database. 665,000 of those were reported to have been received services at some point during that time frame. For the what we call the baseline population, those were the 17-year-olds that took the survey. Just over 15,000 of those took that survey. Certain requirements that you were eligible to be followed up at age 19, and approximately 56% of those were eligible. So we should see those to be surveyed at 19. And as I mentioned, the 19-year-olds are going to come out very soon. It gives you a breakdown of where we are in terms of reporting population, just real briefly. Because of the burden on some of the states that to follow up every 17-year-old, every 2 years, we allowed states to have the option to sample their 17-year-olds, and 12 states opted to do that. As a result, the number of 19-year-olds that will be surveyed or that are supposed to have been surveyed are close to 12,000. So it's a slight decrease from the 15 that originally took the survey at 17. So that just gives you a sense of, if you're looking at our data and you wonder why people are falling out, that is the reason. Again, keeping in the framework, United has an awful lot of information in it. I'm trying to keep it in the framework of what we have here, so I sort of used Karen's framework and outline to show you how some of the United information can fit into some of that framework. And I broke it out: risk factors and protective factors, and that's a fairly loose framework. But to give you a sense of what we saw when the youth were at 17, close to a third, 27%, had ever been referred to substance abuse counseling or assessment. That's an ever lifetime question. All these are ever lifetime questions at 17. At 19, it will be the same question, only asked in the last 2 years. So at 17, 36% reported that they had been incarcerated at some point. 16% had reported having been homeless at some point. and just about 7% reported being a parent, having given birth or fathered a child. In terms of the protective factors, we do collect some of that. 89%, that's a lot. Obviously, most of the youth in foster care receive Medicaid, if not all of them, but not all of them know that. So we had close to 90% saying yes, that they were aware that they received Medicaid. 94% were currently enrolled in attending school, not surprising at 17. And 93% had at least one adult that they could go to support and advice. And we're really excited about that statistic, although use that with some caution. It's a question that has been generating a lot of discussion. It's a big protective factor. The question is, do you have one adult in your life that you can go to for advice and support that is not your current caseworker or spouse or boyfriend or girlfriend? And 93% reported that they do at 17. And then the youth that are 17 were also reported, some were reported by the states who has also received an independent living service. And of those, about half of the youth that took the survey were also reported in the service population. And so about half of them had received an independent living needs assessment at some point in 2011. About half some type of academic support. 38% had budget and financial management supports. And the same amount for the housing, education, and home management. And 42% had health education or risk prevention services provided, as reported by the states. That is not information that the youth has reported. That is the state reported information. And to give you a little bit about the served population, we have 2 years of data collection on that. In the first year, we had close to 100,000, 97,000 records reported by the states. And the most recent year, we had over 100, almost 102,000 records of states reporting services that were received by the youth and young adults. And as you see, the financial management is a big one. The budget and financial management is over 30%. The housing and education and home management, close to 40%. And you can see kind of the breakdown. I won't go through all of them, but a lot of these services that would go into some housing, homeless prevention services are provided pretty strongly with a lot of the states reporting most of those. Some of the other ones you see a little smaller, like the mentoring service or supervised independent living, probably is just a reflection of some of the coding that some of the states are doing. So I will get to that. That overall, our NIDED information is very, very useful, and we can track housing-related experiences and outcomes for those who have exited and preparing to exit. The nice thing about the NIDED, and I know we've talked about linking, the NIDED information is on every youth who has the 17-year-olds at least who are in foster care. They have the same unique ID, so you can match that with the AFCARS or the NCANS data, which is great at the federal level, but states can also do that, as can researchers. So it's a great opportunity to sort of get a longitudinal picture of some of these youth, and as they move forward at 19 and 21, to kind of see what their trajectories are in that. And it's a new source of data that can provide a national indication of the effectiveness. Now, it doesn't quite allow us to do evaluation by any stretch, but it certainly is a great tick mark and a benchmark that we can use to see kind of where the nation is going. It's a nice national picture for how we can move forward or whether things are working or not working. And states also are using it in their own work, both at the county levels, local levels, state levels, just kind of see how they're doing to monitor their own performance. And also to engage youth. We have a couple youth representatives here who've been very involved in NIDED implementation and really working to get the young people out there to take the survey, to get the information that is reported in NIDED disseminated to their states and to the other young people. And caseworkers and managers are also using it to really engage youth in a dialogue. So as they're implementing and many of the states are doing the survey verbally, and so they're engaging the youth, and as the answers come up, they're using it to further engage and to see what services they can refer the youth to or what services the youth may need. There's other opportunities to add questions to our survey. The Knighted Plus, many of the states are using that, which is the Knighted questions plus a bunch of other questions, sort of follow-up questions that gather a lot more information, and states are using that information as well to really inform their programming and decision-making. But as I mentioned earlier, it is a new data system, and we have a lot of changes in state reporting. Sometimes states are continually improving their data collection systems and quality improvement programs. So we're taking it with a little bit of caution in some ways. The response rates vary widely across states. Some states have done extremely well in finding their 19-year-olds. And surveying them at 17 and again at 19. Other states are struggling with that. So as you look at some of the information, just keep in mind that it's an evolving database, and states are still working their way through some of that reporting. There are also some indication that the reporting of the services data is constantly being updated as they go through their data systems to see if the information is being captured correctly in their SACWA systems or whatever information system they collect. The regulations give the broad categories of what the services are, but some of that is difficult to interpret sometimes at the state level. They're not sure what is actually considered an academic service and what isn't, but they're learning, and the data in the services is much more stable. It appears it's stabilizing much quicker than the survey data. It's probably because it's have to be reported more often. But it's a new data collection system. We're really excited about it, and it's showing some great results so far. As the 19-year-olds come forward, we'll see how that works, especially given the extension for many states that are keeping their youth in until 21 and 19. It'll be interesting to see whether the 19-year-olds that are in care are very different than the 19-year-olds who've been out of care. So it provides a great opportunity to kind of get a national overview and a national picture of what's going on out there. For more information, please feel free to check out our websites. There's also some early data brief reports on our website as well that give you some more in-depth information on the first couple of years of data collection. Thanks.